Prostate cancer is the most common cancer in men in many parts of the world. It begins in the prostate, a small gland located just below the bladder that helps make semen. Most men diagnosed are over 50, and the risk increases with age. It's also more common in men with a family history of the disease and in men of black ethnicity. Across the globe, about 1.5 million men are diagnosed with prostate cancer each year. Experts predict this number could almost double to around 3 million cases per year by 2040. This increase is mainly because people are living longer and populations are getting older. While these numbers sound alarming, it's important to understand that not all prostate cancers are life-threatening. In fact, many grow so slowly that they never cause harm during a man's lifetime. When prostate cancer is detected early, before it has spread beyond the prostate, the outlook is very good. Most men live for many years and often die from other causes, not from their cancer. That's why prostate cancer is often described as a condition with a wide range of behaviors. Some forms are aggressive and need prompt treatment, while others are slow and can be safely monitored. For men with slow-growing, low-risk prostate cancer, doctors often recommend a strategy called active surveillance. This does not mean ignoring the cancer. Instead, it means keeping a close eye on it with regular blood tests to measure PSA, prostate-specific antigen, physical examinations, MRI scans, and sometimes repeat biopsies. If the cancer shows signs of growing or changing, then treatment is started. The aim of active surveillance is to spare men from the side effects of treatments that may not be needed right away, while still offering treatment if the cancer becomes more active. This approach is strongly supported by long-term research. The largest and most well-known study, called the Prostate trial, followed over 1,600 men in the UK for 15 years. It compared 3 different approaches: careful monitoring, surgery to remove the prostate, and radiotherapy. The results were striking. After 15 years, the number of men who had died from prostate cancer was very low, only about 3 out of every 100, and the rates were almost identical in all 3 groups. This means that for men with low-risk disease, watching the cancer closely was just as safe in terms of survival as having immediate treatment. However, men who were only monitored were more likely to have their cancer progress or spread to other parts of the body over time, and some of them eventually went on to have surgery or radiotherapy later. Although active surveillance is now standard for low-risk prostate cancer, surgery and radiotherapy are still very important treatments, especially for men whose cancer is intermediate or high risk, or when it looks more likely to spread beyond the prostate. Surgery, called a radical prostatectomy, involves removing the entire prostate gland and some of the surrounding tissue. It can be done through traditional open surgery or using keyhole, laparoscopic, or robotic-assisted techniques. Surgery is often recommended for men who are fit and healthy enough to undergo it, and whose cancer appears confined to the prostate but has features suggesting a higher chance of progression, such as a higher PSA level or more aggressive biopsy result. Surgery can be curative in these cases, but it also carries risks and side effects. Because the prostate lies close to the nerves that control erections and the muscles that control urination, some men may experience erectile dysfunction or urinary leakage afterward. Surgeons now use nerve-sparing techniques whenever possible, and recovery of function varies from person to person. Globally, health experts are concerned that as populations age, prostate cancer will become an even larger challenge. Many men in low and middle-income countries are still diagnosed very late, when treatment is more difficult and outcomes are poorer. A major report published in The Lancet in 2024 warned that prostate cancer cases could nearly double by 2040 and called for better education, early detection in high-risk groups, and more equitable access to modern diagnostic tools and treatments worldwide. In summary, prostate cancer is a very common disease, but one that behaves differently in every man. For those with slow-growing, low-risk disease, active surveillance is a safe way to avoid unnecessary side effects while keeping the cancer under close watch. For men with higher-risk cancer, surgery or radiotherapy can offer a cure if the disease is caught early enough. With ongoing research, better imaging, and new targeted treatments, doctors are now able to personalize care more precisely than ever before. The challenge ahead is to make these advances available to men everywhere, so that all can benefit from early diagnosis, informed decision-making, and the best possible quality of life after treatment. Thank you so much for watching this video about prostate cancer treatment options. If you found it helpful, please give it a like, share it with others who might benefit, and don't forget to subscribe for more easy-to-understand health videos.